treatment for ADHD can be tricky since symptoms might vary from patient to patient, although it most often involves either behavioral psychotherapy, medication, or both. Behavioral psychotherapy is often targeted at children and focuses on teaching the child better time management and organizational skills. For example, having structured routines that they can follow, and then giving rewards when they stick to those routines. Also, involving both parents and teachers are important, and both behavioral parent training and behavioral classroom management have been shown to be helpful for children with ADHD. For adults, behavioral psychotherapy might focus on ways of decreasing distractions and also improving organizational skills. If medications are prescribed, typically the first-line options are stimulants. Since it's thought that low levels of neurotransmitters are involved in ADHD, stimulants are used because they tend to increase the number of neurotransmitters, like dopamine, between neurons, therefore reducing symptoms. Common and well-known ADHD medications are molecules that are chemically similar to illicit stimulants like methamphetamine, but there are some key differences to keep in mind here. All of these chemicals help to increase the release of dopamine from neuron A, but the ADHD medications typically cause a slow release of dopamine, whereas illicit stimulants like methamphetamine cause a really fast release of dopamine. In fact, it's this incredible surge of dopamine that disrupts normal communication between neurons and produces euphoria, and is the reason that illicit substances like methamphetamine are highly addictive. In contrast, the slow and controlled release of dopamine caused by ADHD medications is key and helps a lot of patients improve their focus and their attention. Thanks for watching. You can help support us by donating on Patreon, or subscribing to our channel, or telling your friends about us on social media.
Oké, Tax, dan gaan we nu eerst even de test doen. Doe ik even oordopjes in je oren.
Ja.
Oké, Tax, ik heb nu een scherm voor jou klaargezet.
Ja.
En dan gaan we eerst even beginnen met de ademhaling. Eerst rustig ademhalen en op het moment dat die ademhaling goed gaat, dat voel je zelf ook wel, dat kun je al heel goed. Dus dat zal zo zijn. Dan ga ik daarna een ander scherm aanzetten met het vliegtuig. Zet ik hem aan. Nou, je weet hoe het werkt. Rustig ademhalen en lekker relaxen. Je gaat je ademhaling oefenen.
Ja.
En je ziet het lijntje, dat gaat steeds omhoog en omlaag, hè? In golfjes. Als die omhoog gaat, adem je in. Als die omlaag gaat, adem je uit.
At the start of the neurofeedback training, Tarks focuses on his breathing, observing it and slowing it down, before the EEG feedback training is started. With neurofeedback, the client can learn how to train and regulate his brain activity by getting real-time feedback from his EEG. Tux is controlling the movement of the rocket. It will only fly when he is focused and the brain produces the EEG frequencies which meet the criteria set by the therapist. The BioTrace Plus software analyzes the EEG signals coming from the brain and turns them into audio-visual feedback on a computer screen so the client can learn to control his brain activity. Neurofeedback training in many ways is different from treatment by medication. Unlike medication, the success of feedback training also depends on the motivation of the client.
Living with ADHD, which is not effectively treated, is like trying to run the Boston Marathon with a knapsack of bricks on your back. You can do it, but you've got to work a lot harder than everybody else, and you don't get the rewards you would for somebody else with the same ability and the same effort. So it's important to provide, there are frustrating things where people with ADHD, kids with ADHD are often struggling to try to get things done that most other people do easily. Or they have to go back and do it again and again. And they're often getting feedback from their peers or from teachers saying, you're just not trying hard enough. And providing some support for things like that is really very, very basically important. That's what helps kids to keep going in the midst of the frustration so they don't give up hope for their own ability to learn and to be successful. One thing that's often helpful is behavioral strategies for some types of difficulties. For example, with a child who's very restless and is having trouble staying in his chair in school, at his desk. Or where a child is having difficulty with responding too impulsively when he's frustrated and dealing with other kids, or when her feelings are hurt. Or where a person tends to shoot off their mouth the minute they get frustrated or annoyed with somebody. Behavioral strategies can often be helpful. What that involves usually is carefully looking at the specific problems that come up and finding ways of teaching the child different ways of dealing with it, and then reinforcing, encouraging those behaviors, not just yelling at them, because you catch more flies with honey than you do with vinegar. And you're going to be able to get a better response in terms of getting somebody to stop doing something you don't want them to do if you encourage them to do the things you do want them to do. And there's a parenting coach section on the Understood website which provides a lot of behavioral methods to help with some of the difficulties with ADHD, particularly with younger children. The other treatment approach which is often used for ADHD is medication. It's the most effective method we have for dealing with many of the problems of ADHD. But it's important to understand medication for ADHD cures nothing. It's not like you have a strep throat, you take an antibiotic and it knocks out the infection. It's more like my eyeglasses. I have a problem with my eyes. I can't read typewriter-sized print without my glasses. If I have them on, I can read it about as well as anybody can, but if I take them off, it just looks blurry to me. I can't see. Just as my eyeglasses do not help me when I don't have them on, the medicine doesn't help when the medicine's worn off. The fine-tuning of medicine is critical in order to have it be effective. Sometimes very little children need bigger doses and very big adults need very small doses. And the prescriber needs to take that into account and talk with the child, talk with the parents to see how's it working, are there difficulties with it, and to make adjustments to try and find something that will work, knowing these do not work for everybody and they don't cure anything. So there are behavioral interventions that can be useful. There are medication interventions that may be useful. It's a matter of looking at this particular child at this particular age in this situation and thinking about, okay, what has the best chance of helping with the things they need help with?
Key takeaways. There are two primary treatments for ADHD: behavior therapy and medication. It's important to fine-tune medication. Some little kids need big doses, and some big adults need small doses. Behavior interventions often help more when they